like to review with you some of the analyzed tools available to you once you've finished scanning to assess if you like your impression or not. So the first thing to keep in mind is when you've reached this point in your impressioning technique, it's ideal to post-process your scans so you can actually see the data that's been accurately captured in your impressioning. The other thing I like to do is at this point, treat my impression as a stone cast, and I turn off the color to do so. It gives me a little bit of definition for me to see what I'm trying to achieve. So the first tool that we have here is the direction tool. This tool allows us to evaluate our preparation to determine if there's going to be any issues with undercuts adversely affecting the path of insertion. The software itself will pre-select a path of insertion, and as you see, the one that it's selected right now is indicating that there is an undercut present in the preparation. This color gradient here reflects the degree to which an undercut may be present, with red really reflecting an area that will be of great issue. I have the ability, though, to take a look at my preparation and say, you know what, I don't necessarily agree with what the software has auto-selected as a path of insertion. I think that this would be a better one, so I'm going to use this view, and I can assess my preparation, and I really determine that, you know what, there really isn't an undercut issue with this prep. So I don't need to modify it because I know that if I use this path of insertion for the design, the crown should seat without any issues. The next tool available to me is the margin marking feature. And I have the ability to go ahead and select auto set, and the software will try as best possible to mark the margin. I can correct for that by then drawing where my margin actually is with my mouse and just tracing along it. And any areas that may need minor modification, I can actually click on the margin and it will snap to that area. And like there and like so, and right here. And what's nice about this feature is that you as the clinician know exactly where you've set your margin. If you go ahead and take the time to use this feature in the software, the laboratory will not be reliant upon the technician to guess where the margin is. It'll have the exact information as to where it needs to be provided by you, the clinician. So the next tool here is clearance. Now, clearance is desirable because you want to make sure that you are providing enough interocclusal reduction for the restorative material that you will be prescribing. So as you see here in this preparation, there is enough clearance for about 1 millimeter's worth of clearance, which would be sufficient for all zirconia restoration, but may be an issue if I was prescribing an Emax restoration. If that were the case, I would go ahead and cut this area out of the scan, and I would reduce the prep intraorally, and I'd rescan that area to fill in the new data to make sure that I have enough interocclusal reduction. So as you can see, this clearance feature is very useful tool in making sure that you're going to have a long-lasting restoration. The annotation tool allows me to communicate with my lab with specific issues that may be present in my preparation and in my impression. So as you see here, I can make a little note. And the laboratory will see exactly what I'm referring to when the scan is submitted. It's a nice little feature. Lastly, shade matching. So the TRIOS has the ability to go ahead and capture shade matching. And what you'll see here is when I click on this feature, a blue gradient shows up. Wherever there is blue, that blue marbling effect, the scanner has not captured sufficient data to provide accurate shade matching. So what you're going to do is you're going to focus on using those areas that actually look like tooth structure to capture the shade. You can first click on a tooth anywhere you'd like, and it will go ahead and mark the shade there. If you want to add shade matching, another shade, let's say, I want to get a cervical area, so I can come down here, and there's my A35. If I want to add another one to another tooth, I can do so, and so on and so forth. If you see this icon come up, it's reflective of there not being enough data for shade matching to be accurate. If you'd like to remove a data point, you go ahead and choose this remove, and then you just click on that one. I hope that you found this useful. My name is Dr. Barbara Jerem,